Our next paper will be meta-analysis of safety and efficacy of laparoscopic resection for gastric stromal tumors by Dr. Zhou from Xinjiang University, China.
Good afternoon. My topic is a systematic review and a meta-analysis of safety and efficacy of laparoscopic resection for gastric stomach tumor. I'm Yiping Mo from Hangzhou, it's close to Shanghai, China. Nothing to disclose. Laparoscopic surgery for GIST is rapidly developed in the past decade, but the issue is sometimes some doctors say maybe rupture of the tumor or something, so there is some whether is laparoscopic surgery have the same result with the open surgery. So we make a meta-analysis for the literature about the laparoscopic was the open surgery for gastric GIST with respect to the surgical outcome, mobility, mortality, function recovery, and long-term survival. There is database from PubMed and all are limited to the English. The total of about 1,060 cases was 516 was laparoscopic surgery, and 544 was open. They are including 19 studies was from the 10 different countries or regions, most from Japanese and China and the United States. And we use the continuous variable using the white mean difference is mean WMD. And we also use risk factors RR ratio, and we use the Lambda effect model. The primary outcome for the operation time, there is no statistical significance difference between the two approaches. About the blood loss, that show significant low in the laparoscopic group. The WMD is negative 40 and P is the primary outcome for hospital stay also is significantly shorter in the laparoscopic group. For the complication, there is also significantly less in the laparoscopic group. For recurrence, there are also significantly less in the laparoscopic group. We also do some subgroup analysis because sometimes the surgical type or tumor size may be some risk for recurrence. So we do some subgroup for the study of the wedge recursion, and the study was compared tumor size and the risk index. The subgroup for wedge recursion, there is also the recurrence rate, it was similar. For the tumor size and the risk index, the recurrence risk was also similar. There are also available data about the recurrence pattern and the survival outcome. They are also similar. This is the data from the literature. And so we can get the conclusion laparoscopic resection for gastric GIST was a safer and feasible procedure. It was less blood loss, less overall complication, and quickly recover. And laparoscopic surgery will not increase the risk of the tumor, the relapse and metastasis. The long-term survival, situation of the patient with GIST was mainly dependent on the tumor risk itself. Thank you all and welcome.
Thank you. Okay. Dr. Rosen?
Thank you for your presentation. One issue with the random effects model, and one way of getting around it would be if you either requested the original data from the those who published it, or used studies that had homogeneity. So, for example, weren't looking at patients who had emergency surgery or perforated or hemorrhage or anything like that. So, just a question as to whether you considered going back to look at the primary data, which is a common critique of meta-analysis. Otherwise, thank you very much.
Very good question. I think for the most of surgery was use the open, we can avoid the aperture and can find the tumor easily. But laparoscopically, the patient may be recover well, but sometimes some maybe make because the tumor is too big, sometimes it may be aperture, and sometimes the tumor is too small. It have difficult to find. So and this is also not so common disease. So we make a literature review.
Would you comment on, you've compared laparoscopic and open surgery, but what we are seeing rapidly increasing is endoscopic resection, and the comparison of the effectiveness of a surgical approach, whether it's open or laparoscopic, versus an endoscopic approach. Do you have a comment or a thought on that from the work that you've done?
I think for resection, the laparoscopic is more easy than endoscopic. But endoscopic can find very small lesion is easier, but the resection and the risk is more difficult to resection by endoscopic.
Yes, I would certainly encourage you to take your study approach and consider the comparison of those two groups, surgical versus endoscopic, because I think there is some question of whether we're accomplishing true R0 resections with some of the endoscopic resections, which we may effectively take care of the problem at the time of the procedure. However, our long-term outcomes, such as recurrence or more rapid death, may be altered by that, and it's very timely. So thank you for this presentation.
Okay, thank you. It's a very good suggestion. Thank you so much.